Thank you again for having me today. So I'm Josh Pahys from the Philadelphia Shriners. Present to you some of the websites that are out there, certainly not all, because good Lord, there's 1,000 of them. And then some of the ones I was on here, the firewall Shriner wouldn't let me get on it. It says there's a lot of information out there, some good, some bad, and some really ugly. So it's not at all the definitive group of them, but there's some trusted sources that I think you and your physician can certainly look for, but certainly there's an endless amount. I would start with the SRS.org, Scoliosis Research Society. This is the sort of premier study group society for scoliosis. It's been in practice now for just over 50 years. The website was actually just revamped. I was fortunate enough to be a part of that. But it's got a lot of information on it for everybody, and it's in for physicians around the world, also for patients and families. It's in plain language. They try not to make it overly complicated so you can't understand things, but just put it in terms and in verbiage that patients and families can understand and really wrap their brains around. Because this is a lot. Like I said, the internet is an amazing place, which I learned even more so putting this thing together. It's quite terrifying. But there's spots for adolescents. And again, plain language, just discussions on what is scoliosis, what does this mean for me, what lies ahead. Again, knowing you're not alone. For parents who want to read a little bit more about things, again, from reputable sources, on a number of different diagnoses, not just scoliosis, kyphosis, back pain, spondylosis. Frequently asked questions. A lot of these things will pop up for families, and you can sort of type these in, and most of your questions will be on here, I would imagine so. And also, if you want to find a specialist, if you're in, a major metropolitan area like Philadelphia, or if you're out, in the middle of the Midwest, where there may not be as many doctors around, you feel like you may be out on an island, you can type in your area here. Just type in a zip code, just like you're looking for a restaurant, and they'll can find you a Scoliosis Research Society fellow or member that may be in your area. So again, the Scoliosis Research Society, their mission is to foster the optimal care of all patients with spinal deformities. It started over 50 years ago with 35 members. Now it has over 1,200 physician and allied health professionals from all over the world. The membership process, just sign up for it. It requires a 5-year application process, submitting all of your cases, operative and non-operative. So this isn't just a society you can sort of sign up for if you want to. This is something you have to be committed towards, and your practice, majority of your practice has to be involved in spinal deformity. The website is now newly redesigned. We're getting it that people are on the internet more so than the doctors are. So they redesigned their website. It's available in 12 different languages, so it can be available to folks all over the world. SettingScoliosisStraight.org, certainly a little bit of bias here, but this is the website of our foundation. It has a lot of excellent information as well as the handbook. There's some of them outside today. It's available free online. Again, an excellent resource for patients and families. It's in sort of just plain language, you don't get too much lost in the weeds of doctor speak, but it is a fine resource for patients and families to learn about scoliosis, know that you're not alone, and also the different treatment options that are out there. A little bit about the Harm Study Group, the database that it has. You can look in there and see where all this stuff come from. Where is all this information? Are we just making it up? Is it all anecdotal? No, it's based on thousands of patients over 20 years that have been entered into a database and looked at with a fine-tooth comb over the last 20 years. So the Harm Study Group was established, we said, in 1995. Now it has over 3,000 patients that are in the database, some with up to 20-year follow-up, not just with idiopathic scoliosis, some with kyphosis, cerebral palsy as well we're looking into to expand the breadth of research that we're doing in the Harm Study Group. There's over 30, it's actually up to 40 orthopedic surgeons from 20 institutions across North America and Europe that are involved, all with the goal of expanding the understanding of scoliosis and the treatment process involved in it. We've published over 150 peer-reviewed journals, we said before, and we've had over 600 presentations at national and international meetings. KidsHealth.org is another excellent website developed by the Nemours Foundation. It's reviewed by pediatricians and medical experts. It's one of the most viewed sites on the internet for health information for kids, looking at health, behavior, and development from birth to teen years. Again, this is something that's been put on by pediatricians and medical experts. It's a good, trustworthy website for a litany of things, including scoliosis. Scoliosis.org, and you hear from the National Scoliosis Foundation a little bit later today. Another excellent website that isn't all just from orthopedic surgeons, but a myriad of allied health professionals as well. It's the goal of the National Scoliosis Foundation is to improve the lives of people with scoliosis. It's been around now since 1976. They're a huge advocate for early detection, raising awareness of scoliosis, and also it has both physician and non-physician members as part of it working together, again, to understand this pathology and how best to treat it. It does provide a number of resources for patients and parents as well, which I found really, really helpful. For younger kids, so not everybody has adolescent idiopathic scoliosis. There are some folks who have early onset scoliosis, defined as that, which arises before the age of 10. There's two great study groups out there, the Children's Spine Foundation and the Growing Spine Foundation. So children'sspinefoundation.org, growingspine.org. These are two study groups that of physicians focused on the supporting medical education and scientific research to optimize the care of the early onset scoliosis groups. So doesn't just affect all, it's the majority of it. There still is a healthy proportion of kids that have this condition early on at the ages of 0 to 5. So this is the more sort of physician and medical run websites that I would certainly recommend or look into. This SRS.org website does have a number of also websites that they trust as well you can look into. The Curvy Girls, Scoliosis.com, not just Curvy Girls, which I learned trying to type that in. Don't do that. I get in trouble for that. They told me that was the website. Careful. This is why I was glad I grew up and not in the internet age. But anyways, moving on, this is more now the patient and family-centered like support groups that are out there, which I think is just as important as the treatment. You know, it's not all about your doctor visit and going to visit an old crusty middle-aged guy, but there's a lot of resources out there for patients and families knowing that you're not alone. I think the saying, if you will, of the mantra that Curvy Girls group is "We've got your back," which I think is really cool. It's a network of peer-led support groups that reduce the emotional impact of scoliosis. We've got your back, so you are not alone in this this condition. It was established in 2006 and now has an international membership. There's a bunch of private discussion forums for parents and patients that's just for families, not outside of the physician groups. It has information on local support groups are virtually in every region of the United States. There's a myriad of them just here in Philadelphia alone. Along with that, StraightTalkScoliosis.com. This is the book that a lot of the Curvy Girls got together and wrote as a sort of just a self-help book. Again, realizing you guys are not alone in this condition. There's a lot of folks out there, and how do I get through it? This is a great resource for that as well. A lot of patients have found this very, very helpful of mine. We already talked about SOSORT just before, so I'll kind of go over this a little bit more quickly. But again, it's the Society on Scoliosis, Orthopedic and Rehabilitation Treatment, founded in 2004, focusing on conservative treatment for spinal deformities. It's a great group. Their official journal has the Scoliosis and Spinal Disorders. They're currently partnering with the SRS non-operative committee. The SRS itself is again a very large group, but one of their subcommittees is the non-operative committee. So the SOSORT and SRS are working together to develop these guidelines for new research, which we've been talking about. We really need to have a lot better research for these sort of non-operative treatments, but do it in the right way. ScoliosisRehab.com. We touched on the Schroth method. This is the Barcelona group out of ScoliosisRehab.com. So the Barcelona Scoliosis Physiotherapy School. It's a slight modification of the initial work from Katarina Schroth, founded by Beth Jansen, as we talked about before. It's treatment in conjunction with bracing, the Regio Chenu brace. And again, very important. A lot of the stuff online you'll see, and the SOSORT guys discussed on as well, is this is in conjunction with bracing, which we've seen by Dr. Weinstein, has an excellent track record. Some other conservative treatment options. Again, there's a lot of stuff out there. I don't say this to, take everything we say with a grain of salt, but also look deeper in what you find. If it sounds too good to be true, look a little bit deeper into the research or what the results that they're presenting. And this is not to badmouth anyone, but just to say, really take a look at what the evidence that they're presenting, because that's what we were tasked with doing, is just present the evidence and then let the patients and families decide. So the spine cord braces, we talked about Mr. Lawal, it's a flexible scoliosis brace with straps. There's a lot of stuff on the internet about this. It looks really nice. It's not a hard brace. It hides under your clothes. Dr. Asgar may get a little bit into this further later. There's been some studies on this with much larger groups of patients. This is in peer-reviewed journals. This is not anecdotal data. The spine cord brace in the study by Gutman back in 2014 didn't really prevent curve progression as effective as a Boston brace when it went head-to-head. The odds of curve progression greater than 5 degrees or the curve reaching greater than 45 degrees was actually double that for the spine cord versus a traditional brace. There was another randomized prospective study looking at spine cord brace versus rigid brace. Their conclusion was, the first study, by the way, had 245 patients. This study had 40 patients, 20 in each group. Randomized prospective study, spine cord versus a rigid brace. Curve progression significantly higher in the spine cord group versus the rigid brace group. That's not what it says on their website, so again, I just caution you to look deeper and deeper if you find anything. What is the actual evidence that's out there? What is the peer-reviewed evidence? There's the CLEAR method, which you'll find a lot of stuff stuff on the internet for. It's the Chiropractic Leadership, Educational Advancement, and Research. So there's a combined regimen of soft tissue therapy, chiropractic manipulative therapy, and neuromuscular re-education. A lot of stuff we've heard about today. But again, we're just looking for what is the evidence that supports it. Is it out there? If you look deeper into their website, you'll find that they cite this study back from 2014. If you look at the actual study itself, there's only 22 patients. As we proposed in our other studies, that we put out there, between 200 to over 1,000 patients in these studies that we look at over several years. This study that they often cite to, as a proponent for the CLEAR method looked at and stated a 17-degree average COB reduction was reported. Well, that was only in 22 patients, and you wonder if those patients were self-selected or if they were cherry-picked. You don't know. And only 19 of those patients had their data reported, so what happened to the other 3 patients? The results were only reported after 4 to 6 weeks of treatment, not after 2 to 3 years. What happened to these curves later in life? Or was it just they find a window there? We don't know. And it's not to say this is wrong, it's just we don't know yet. We don't have long-term data. A lot more study needs to be done. But just approach all this with caution. So they did, the CLEAR method does have a follow-up study, which they'll cite in 2014. The manuscript, magazine that was published in is just that. It's a magazine. It's not a peer-reviewed medical journal. The American Chiropractor. This is the page that it was on, developing a scoliosis-specific chiropractic protocol. Again, a great idea, but the evidence just may not be there. If you look off to the right, it says, get your lawyers to run after you and attract new personal injury patients. That's right next to this supposed scientific article. So again, just be careful. If you look further into this study that they're reporting, it says their long-term results were not recorded. Well, why were they not recorded? This is the patient here on the right and left. This is after 2 weeks of treatment. What happened to them in the long term? We don't know. It hasn't been reported. It hasn't been studied. They don't tell you that on the website. Buyer beware. In the conclusions that they report, certain flaws occurred in the data collection which prohibited or prevented publication of this data in a peer-reviewed scientific journal. Why is that? Again, you just really need to look at what's on the website. There's a lot of fancy bells and whistles on the internet, and where is the evidence to support that? Just be careful. That's all I'm asking. The activity suit, it's another one. This seems pretty cool. It's not a hard brace. You can wear it underneath your clothes. It's nice and it's comfortable. They do cite one study in the Journal of Scoliosis Rehabilitation from 2013, 62 patients with 1-year follow-up, idiopathic scoliosis stabilized or corrected in 90% of the patients. They do report, which is a good thing, they do need longer follow-up as necessary. But if you look at which patients were actually involved in the study, over half of them were adults. The curves don't typically progress, as Dr. Weinstein's natural history will show you, in adults at all anyway. So at 1 year, most typical adult scoliosis will progress about 1 degree. So it may even matter if you wore a brace that was not required by insurance, so it was not paid for by insurance, and could potentially be eating away at your child's college fund. Just buyer beware. If you look at where is the actual patients, these two windows here are the immature patients. And then by immature, they say less than 18. A 16 to an 18-year-old girl technically could be skeletally immature, and her curve may not progress anyway. So, and if you even look a little bit closer, immature ones that progressed, that's this big. Oh, it's not coming up, dang it. This is immature, progressed greater than 6 degrees. This is immature, did not progress. So like a whole pie, this is all it worked. Okay, and you don't even know if that was idiopathic, immature patients. Is that skeletally immature or just less than 18, which is not necessarily the same case. So again, how the data can be presented in many different ways. If you look a little bit closer at it, it can be a bit unnerving. I'll close with the Scoliosis Research Society's statement on physiotherapy, scoliosis-specific exercises. We're not all, surgeons that are out there, where hammers and everything is a nail. At the present time, we say there's no evidence supporting that scoliosis-specific exercise to be offered in substitution of bracing and treating progressive idiopathic scoliosis, but our Schroth friend said it can be potentially in conjunction with it. So that's what we're working, and definitive research is underway now to see how can we combine our efforts for the best possible outcomes. I'll close with a 12-year-old female idiopathic scoliosis and Schroth exercises, a patient of a friend of mine from Greenville. This is her in October 2014. Her physician and her orthotist as well as her Schroth therapist worked together, and she did have a good progression. But again, this is over time, 18 months, not just 4 weeks. So it does work. It can work, but in the right setting and under the right supervision. But don't let this be you. This is a 15-year-old, very well-educated family that for 7 years they kept burying their head in the sand saying, I can't, I'm just going to keep going with this conservative treatment. Her curvature progressed over 140 degrees, which required a 6 to 8 week stay in the hospital. She's doing great. She had a posterior spinal fusion. Her life is back. But I just caution caution you against getting lost in the weeds of all these false promises that may or may not be out there on the internet. So I encourage you, websites reviewed and approved by a physician are the best place to start. Discuss everything with your doctor. Discuss with your pediatrician. There's no website can take the place of an in-person visit with a physician. Any information you read about should be discussed with your physician. And again, as we said, if it sounds too good to be true, buyer beware. This is just, I challenge you to embrace your curve. This is one of my patients who's about 4 weeks after spine surgery, doing great. This guy, you can't even see his brace because it's camouflage, which I thought was kind of cool. It made him smart. He's now able to do his Rubik's Cube. But so good luck out there.